Hello everyone and welcome back to my channel Physio Trends. So as you can see on the screen, today I'm going to discuss about the accelerated rehab protocol especially for ACL reconstruction. In last few videos I was talking about how Rishabh Pant got injured and how he has underwent two ligaments injury reconstruction and how he's going to wait for the ACL reconstruction and what he is going to do after ACL reconstruction from the physiotherapy point of view that we are going to discuss in today's class because this is accelerated rehab protocol specially given to the athletic population. Here in this video, I'm going to tell you that what are the goals for each phases as well as what will be the criterias for each phases to enter after completion of one phase. We are going to discuss this rehab protocol in 5 phases, in which fifth phase is mainly for the sports related drills or sports related activities. So let's begin with this video and start with the pre-operative phase first because my dear friends and physios, we know that pre-operative physiotherapy is most important when it comes to any ligament injury or let's say any pre-planned surgeries like TKR, THR or anything. So goals over here for pre-operative phase will be one will be diminishing inflammation, swelling and pain, restoring normal range of motion, which I also talked about when I told that he has underwent MCL and PCL ligament injury. We are going to wait for at least 6 weeks for performing ACL reconstruction surgery. So these are the goals for that. Restoring voluntary muscle contraction. Again, quadricep muscle contraction is very much important. Patient education to prepare for surgery. In this, we are going to educate the patient about what kind of surgery he is going to undergo, as well as what kinds of rehabilitation exercises will be there after the surgery, what kinds of movements will be most important after the surgery. Everything will be educated for the patient in this phase. Next thing in this phase, what we are going to do is we are going to apply knee brace or sleeve to reduce pain for the patient. Weight bearing will be according to the tolerance of the patient without any assistive devices. And patient education, as I told, reviewing the post-op rehab program and selecting appropriate surgical date according to whatever the goals we have for the pre-operative management, they are achieved or not. Exercises mostly in the preoperative phase for ACL reconstruction will be ankle pumps, passive knee extension to 0 degree, which means that complete knee extension has to be achieved, passive knee flexion till tolerance, straight leg raises, mini squats, lunges, step ups, electrical muscle stimulation to quadriceps during voluntary quadricep exercise, which is approximately 4 to 6 hours in a day, and cryotherapy in cases of swelling or let's say inflammation still persists. We can use the cryotherapy as well. Now here I want to make sure that you understand what is mini squat, what is half squat and what is full squat. Full squat, I don't need to explain because we all know that when you go completely down, that is considered as full squat. Half squat is nothing but when you go at least up to half range of motion, which is 90 degrees of knee flexion and hip flexion, that is half squat. And mini squat is nothing but when you're performing just mild knee flexion and coming back to extension just to activate your quadricep muscle, that is considered as mini squats. Now talking about post-operative phase, as this is an accelerated phase, we are going to discuss it in exact days and on each day what all exercises has to be given, what will be goals and again criterias. So immediate post-operative phase, which is day 1 to day 7 post-operatively. Goals for us are restoring full passive knee extension because that is most important movement for any knee ligament injury reconstruction. Second one is diminishing joint swelling and pain, restoring patellar mobility, re-establishing quadriceps control, gradually improving knee flexion, and restoring independent ambulation. Here, independent ambulation doesn't mean that patient is walking without any assistive device, but with using assistive device and brace, patient should be able to walk independently. That is what it is meant for. So let's begin with the exercises for post-op day 1. With brace, post-operative brace applied to knee locked in full extension during ambulation because that is exactly the range in which we want patient to weight bear and perform the activities or ambulation. Weight bearing is required. Two crutches can be used as tolerated. Exercises given are ankle pumps. Obviously, we know what is the importance of ankle pump. We can prevent DVT as well as we can improve the blood circulation. That is why ankle pumps are given. Overpressure into full passive knee extension, because we want to achieve complete knee extension at least passively in this first phase. Active and passive knee flexion, in which our goal should be 90 degree of passive knee flexion by day 5. SLR, which is straight leg raise, quadriceps isometric setting, static quadricep exercises, hamstring stretches. Why? Because again we want to achieve complete knee extension. Mini squats, weight shifts. Now mini squats and weight shifts plays very important role over here. Why? Because they are working on your proprioceptors. We know that knee joint, ankle joint, hip joint have major proprioceptions for performing our daily living activities. And if we start working on them from the beginning of the rehabilitation, it can help us for the future rehabilitation protocol for more balanced and coordinated activity. That is why mini squats and weight shifts are started. CPM, which is continuous passive movement as needed, but our goal is to achieve at least 50 degrees of flexion for the knee joint on day 1. Post operative day 2, 3, with brace knee locked at 0 degree of extension for ambulation and unlocking for sitting position. Why sitting position we are unlocking? Because we want to achieve some flexion also in the knee joint there. Weight bearing, again, 2 crutches as tolerated for the patient. Exercises given are multi-angle isometrics for knee extension at 90 degrees and 60 degrees. Now here, most important thing is we are giving isometric exercises but at different angles so that we can preserve muscular properties in very much good way. Patellar mobilization, because patella movement is very much essential for getting achieving knee range of motion, knee flexion extension. That is why patella mobilization is initiated. Ankle pumps, SLR, standing hamstring curls, which is nothing but in standing position. We ask patient to flex the knee joint, which is against the gravity, which can improve the muscular strength. And CPM 0 to 90 degrees as needed and tolerated by the patient. Post-op day 4 to 7 exercises. Remove brace to perform range of motion exercises 4 to 6 times per day, which is in bed. We are not performing with weight bearing without brace. Make sure that knee flexion of 90 by day 5 and 100 by day 7 is our goal. And proprioceptive and balance activities, which is just now I told you all that it is something called as mini squat, weight shifting, as well as performing activities in the air, making circle, which we have learned already in the equilibrium, non-equilibrium exercises that can be initiated for improving proprioception and balance activities. Now talking about phase 2. Phase 2, early rehabilitation phase, which is week 2 to week 4. But before entering the phase 2, we should cover up all the criterias. And the criterias are that first thing is quadricep control has to be there, which means that patients should be able to maintain knee extension under full individual control, independent control. Full passive knee extension should be achieved completely. Passive range of motion of 0 to 90 degrees should be there. Good patellar mobility is required. That is why we have started already with the patellar mobilization in the phase 1. Minimal joint effusion, which has to be reduced because now it is post-op second week, it has to be reduced. Independent ambulation using brace and assistive device should be present. Goals over here are maintaining full passive knee extension, gradually increase knee flexion. If you remember in phase 1, we had achieved 0 to 100 degree of flexion. Now we have to try increasing the flexion range, diminish swelling and pain, muscle training, restoring proprioception and patellar mobility are goals for the second phase of accelerated ACL rehab protocol. Exercises in this phase, what we are going to give is self range of motion stretching, which is 4 to 5 times daily. Now, this stretching is given for both quadriceps as well as hamstring muscle, changing the position in supine to prone lying position. Muscle stimulation to quadricep with exercise, which we also performed before surgery, pre-operative phase. Now we are starting with the half squats because at least 90 degree of flexion is achieved in the knee joint. Front and side lunges, bicycling, overpressure into extension, well leg exercise. Well leg means a good leg which is not operated. That leg strengthening exercise also has to be started in the phase 2. Progressive resisted extension program starts with 1 lb, which is 1 pound, and progresses 1 pound per week. We can also use 1 kilogram or 1.5 kilogram as a unit in this particular protocol. Week 3, we are going to perform passive range of motion at least 0 to 115. Pool walking has to be initiated. This we also discussed in the Rishabh Pant's rehab protocol that he has initiated with the pool walking, and all the details are given in that video, so you can watch in that particular video. Eccentric quadricep exercise. Now, my dear friends, this is very much important exercise to give in phase 2. Why? Because eccentric control of quadricep muscle is very much important when it comes to perform knee flexion extension and weight bearing activities. So that is why it is very essential we start with eccentric quadricep exercise. It also improves control of the quadriceps. That is also one of the factor we start with this exercise. Now we start with lateral lunges, not directly anterior forward lunges, because it is ACL reconstruction. We don't want more TBL translation in the anterior direction, but we need to strengthen the muscles surrounding the knee joint as well as hip joint. That is why we start with the lateral lunges first and lateral step ups first, and slowly we progress it towards the forward lunges and forward step ups. Stair stepper machine. Now the question comes that why we are not using stepping without any machine, and we are using stair stepper machine forward walking. The reason behind that is stair stepper machine moves by itself just like an escalator or treadmill, and that is why energy expenditure or pressure what you have to put on the leg is comparatively less when we talk about the stair climbing. That is why stair stepper machine can be the best treatment for the second phase in week 3. Week 4 to 10, we are going to continue with the control ambulation phase, which is phase 3. Now, what are the criteria to enter phase 3? So, we should at least have active range of motion of 0 to 115 in the knee joint, quadricep strength greater than 60% of contralateral side, minimal to no joint effusion, and no joint line or patellofemoral pain. Now the question comes that how to determine whether you have strength which is more than 60 percentage in compared to contralateral side. So you just have to find out one repetition maximum on the contralateral side, and of that 60 percentage weight activity you have to perform with the affected limb. If patient is able to perform, that means okay, this criteria is fulfilled and we can continue with the next protocol or next phase. Now let's see what all exercises we are going to see in the phase 3. So here the goals are passive full knee range of motion. We know that full knee range of motion is somewhere around 125 to 130, improving lower limb strength, enhancing balance and neuromuscular control, and improving muscular endurance. Now, my dear friends, if you just focus over here, what we did in phase 1, we worked on range of motion. Phase 2, we started working on the strength, and phase 3, along with the strength, now we are also working on the endurance of the muscle. That is our goal, and that is the way rehabilitation should go always. Exercises what we are going to give is progress isometric strengthening program, which is like before we giving the multi angle isometrics in 60 to 90, but now we have to give every 10 degrees or 20 degrees isometric exercises. Leg press can be started now. Lateral step overs, front step down. See, if you remember last phase, I was telling that we are just continue with the lateral step ups, and initially slowly we will continue with the forward step up and step down. Now we are starting beginning with the front step downs, and this is the reason we had started eccentric contraction of the quadricep, because to perform step downs, eccentric contraction of the quadricep is very much important. Biodex stability system is nothing but isokinetic movement, for which we use Cybex machine or dynamometers. I am going to show you that in the next few slides. Proprioceptive drills for improving proprioceptions of the knee joint, as well as pool programs, especially backward running. Backward running plays a very important role when it comes to phase 3 and improving the muscular endurance as well as strength. This is what I was talking about, isokinetic activity dynamometer or Cybex machine, with which we can control the velocity of the movement or exercise, and we can give resistance at different angle, different resistance by using this equipment. Week 6, we start with pull forward running and agility drills. Now, what is agility? So, ability of a person to change the direction quickly. And that is why you can see on the right side over here, the kind of drill is given, like continuously changing the direction of the movement with speed. That is what the idea behind the agility drills. Balancing on tilt board, progress to the balance board throws, like for example standing on the balance board and also performing throwing and catching activity, which improves your proprioceptors as well as balance activities and helps us for the strengthening purpose. Week 8 we start with the plyometric leg press. This is nothing but along with leg press you push it so hard that it goes and come back. I'm going to show the picture for that also in the coming slide, so you will get an exact idea. Perturbation training also is nothing but on the balance board or different surfaces we ask patient to stand and perform the activities. Those pictures also I'm going to show you all. Isokinetic exercise, just now we saw the dynamometer, subex meter for isokinetic activity. Bicycle and endurance activity has to be continued in week 8. Now this is one more style we can give agility drills. This is what I was talking about, plyometrics leg press, in which as we can see person is lying down performing the leg press and trying to throw the equipment so that we can get the powerful impact or force generation in the muscles, which is very much important in the later phases of the rehabilitation. These are the perturbation training. As you can see over here, different surfaces are there for the perturbation training. As you can see, first is a stable surface, and the last one we can see person is standing on the surface with wheels. So balancing on that can be difficult one. Next phase is phase 4, which is advanced activity phase, which is between week 10 to week 16. And criteria to enter phase 4 are active full range of motion, most important. Quadriceps strength more than 80% compared to contralateral side. Before phase, we had the criteria of 60%. Now we have 80% of criteria. Satisfactory clinical exam means no inflammation, no swelling, no pain around the knee joint or patellofemoral joint, and hop test 80% of contralateral side. Now, what is hop test? That also I'm going to show you in the next slides. Goals over here are normalizing lower extremity strength, enhancing muscular power and endurance, improving neuromuscular control, and performing selected sports specific drills are going to be our goals in this phase. And the last phase for this is return to sports activity. And my dear friends, as it is shown in this picture, this is a hop test in which person stands on one leg and tries to jump maximum distance and land on the same leg. The distance which is covered for the contralateral side, which is an unaffected side, it has to be at least more than 85 percentage of that on the affected side to enter this particular phase, which is the return to sports activity phase, which is from week 16 to 22. Here criteria are full range of motion, normal joint proprioception, and functional hop test at least 85% or greater of contralateral side. Goals here are gradual return to full unrestricted sports, achieve maximal strength and endurance. And this is the stage from where we can see that particular player, athlete back on the ground, back to the sports. In this case, right now we were started discussion with the Rishabh Pant. So this is the time when we can tell that, okay, now Rishabh Pant will be back on the ground. And as you can see, it took at least 16 to 22 weeks, which if you calculate, it is somewhere around 4 to 6 months of duration. Exercises, again, we are going to continue with the strength training, neuromuscular control drills, plyometric drills, running and agility program, and sports specific training. For cricket, sports specific training is given. There are sports specific tests which are performed for the cricket. That definitely we are going to continue and discuss in the next video, like what all special tests or tests can be performed particularly specific to the cricket sport. So that's it, my dear friends. This is an accelerated rehab protocol for ACL, and that is why even I was accelerating it, because I wanted to make sure that I finish in the shorter duration, but I wanted to make an impactful video that you understand something, you take home something very important from this protocol, and you learn something very important. If you like this information, if you really learned something new, do let me know in the comment section. And if you have any confusion, any doubts, then also please let me know. And yes, please don't forget to like, share, and subscribe to my channel, Physio Trendz.